Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand, promoting change with passion and might, advancing skills.
Hi, good afternoon, everyone. It is my pleasure to welcome you all to this Innovation Spotlight, where we will be exploring an essential and transformative topic preparing for a healthy pregnancy. This topic touches lives in the most profound way. I would like to use this opportunity to talk a little about Dr. Wusu Institute. At Dr. Usu Institute, we are committed to advancing workforce skills and promoting technological innovation through education, training, and research. Transform your future with our expert led online and on site training programs. Whether you are looking for to master digital literacy and computer skills, harness the power of IE tools, creating engaging content through video blogging or design stunning websites, we have a training tailored for you. We also offer after school classes for kids in maths and computer science to equip the next generation with essential skills for the future. For more information, visit doinstitute.org or contact us on 05391 47900 or 0207 115446. I'm taking the numbers again: 0539 147 900 or 0207 115446. A special thanks to our sponsor, Arise Graphic Professionals, your trusted provider for graphic design, web design, and hosting services. Now, back to our main innovation. Bringing new life into the world is a beautiful journey, but it also requires preparation, knowledge, and the right support system to enhance this journey. Today, we are here to explore how innovation, medical advancement, and holistic approaches can help create healthier pregnancies. It is my honor to introduce our esteemed guest today, a highly experienced and passionate midwife, Miss Koramah Margaret. She is dedicated and experienced registered midwife with 11 years of expertise in maternal and newborn care. She holds a Bachelor of Science in Midwifery, equipping her with the knowledge and skills to provide high quality care to expectant mothers and newborns. Throughout her career, Ms. Koramah has been committed to ensuring safe pregnancies and deliveries, offering compassionate support to mothers and families. Her extensive experience in midwifery has made her a trusted healthcare professional, dedicated to improving maternal health outcomes through patient-centered care and best practices in childbirth and postnatal care. Today, she joins us to share her wealth of knowledge on preparing for a healthy pregnancy. Please join me in giving a warm welcome to Miss Koramah Margaret. Thank you for joining us, madam.
Thank you. Good afternoon, good morning, good evening, wherever you're watching us from. Our topic for today is preconception care. Preconception care, pre means before, conception means pregnancy. So, together, preconception care is caregiving to couples or a woman before they embark on a pregnancy. And it's a period of 3 months to 1 year. So, in case you want to get pregnant, let's say in next year, 2026, you can start preparing from now. And it has a lot of benefits, which includes it reduces birth risk, birth defects, and miscarriages. It improves maternal and fetal health care, and it enhances fertility chances and then chances of conception. It enhances early detection and management of medical conditions. Nti like mfasodeɛ a ɛwɔ preconception care no ho ne sɛ ɛprevente miscarriage a dodoɔ no yɛtae ka ne sɛ apɔn wɔ twi kasa mu. anaasɛ nyinsɛn no asɛe. Nti sɛ wopɛ sɛ wonyim na sɛ saa ɔhaw yi sɛ ɛbɛyɛ wo nyinsɛn no ɛnsɛe a, wobɛtumi asiki such care to enhance proper outcome of the pregnancy. And also, it helps prevent the transmission of STDs and other infections. To say, Bia, if your partner is having, let's say, gonorrhea or syphilis or any other condition, seeking such care will help you to detect it and receive early treatment because some of the STDs can produce abnormal fetus or can lead to abortions. Okay, let's look at some of the components of preconception care. We have reproductive awareness, medical screening, um, genetics screening, teratogens, and environmental things. Terms need there, so to have STD screenization, family planning, nutrition, psychological screening, other psychosocial or substance abuse. Okay, let's take a reproductive awareness. So reproductive awareness means that fertility for women. After you pass a particular age, you cannot give birth again, or you can't ovulate, or the other you can get into menopause. So you can't say you will start giving birth after 50 years, where you are not having your menses monthly. So fertility in women decreases with increasing age. So as a woman ages, fertility decreases. And as a woman ages, the rate of giving birth to an abnormal baby or abnormal child also increases. There's a graph there. If I say obi a wadi 20 years a ɔpɛ sɛ onyinsɛn no, the chance sɛ obetumi anyim no higher than say bi a obi a wadi 42, 45 ɛkɔ. Because women have fixed eggs ɛwɔ ovaries mu nti every month you ovulate and every month you get your menses. Once you are getting your menses monthly, it means your eggs are getting finished. So once the eggs are finished, you cannot conceive again. So we should consider our age when it comes to giving birth. And as compared to men, mmarima no deɛ wɔn bɛtumi adi 60 years koraa wɔn bɛtumi impregnate ɔbaa but mmaa no deɛ after menopause you are done with your childbearing ages and woyɛ below 18 years nso a ɛno nso so ɔbaa wobɛtumi anyi but your risk of wobɛtumi anya other complications. Nti yɛwɔ time bi say like women in their fertility reefer is between the ages of 18 to 35 years. Even though within that time you can get a complication, but it's not as much as those after 35 years and then below 18 years. Okay. And we have another chart there, which is showing maternal age and then the risk of Down syndrome, which is another problem, which most of us in the developing countries are going through. You cannot be screened, and even if you are able to screen, you can. There's nothing that you can do it in our area. It's not clear, but what it is showing is that your chance of getting a child with Down syndrome increases with increasing age. So once you age, your chance of getting Down syndrome too increases. So with the last one, it's 50. If you are 50, your chance of getting such a child is one out of six women. So if let's say a man six anymore, a move back with many Down syndrome, and Down syndrome is a chromosomal abnormality, which you can only prevent it by not giving birth at that age. Okay. So next on slide is medical screening, which is another component of preconception care. So with the medical screening, we have diabetes, hypertension, and then epilepsy. It is many, but I'll be talking about only the three of these. So babies born to insulin dependent. So diabetes literally means having high elevated blood glucose. And I say, "Bia, oko clinic na catch us bia, who is yare. So if you have this condition, as a bia, or fasting blood sugar near high, your chance of giving birth to an abnormal baby is high, or your risk of getting a congenital abnormality for your baby is very high. So blood glucose control before pregnancy is important, as the teratogenic effect of hyperglycemia occur during organogenesis. The cause organogenesis is just a big term, but time a baby no start forming, the organs start forming. So as early as 8 weeks, bosome nawɔtwe nwɔtwe ntam na baby no was started forming. At that time, the baby is very sensitive to a lot of things. So yeah, sometimes baby na nim so ɔmo most of them aren't aware that they are pregnant. They might be taking a whole lot of things. But if you have diabetes, you should make sure that your blood glucose is low or is controlled before you get pregnant, because high level of glucose in your bloodstream can lead to fetal abnormality, and it can lead to IUF disease. Your baby can die in your utero, okay, and you can have a very big baby with a lot of complications, okay. So, and if you are a woman, a pregnant one, and you are having diabetes, you can get retinopathy, or you can destroy your kidneys as well. So, seeking preconception care if you are a diabetic client is very important. And even if you are not a diabetic client, it is very important that you know your blood glucose before you get pregnant, since it can have a major effect on your system and your unborn baby as well. And you have hypertension. Hypertension, in the other hand, too, can reduce fertility in both men and women because of poor blood supply to the vital organs and then reproductive system. Nti sɛ obi wɔ mogyabosoɔ anaasɛ hypertension a, ɛno nso ɛkwan sɛ obetumi you can get more complications as well. You can get preeclampsia, which is another complication of hypertension in pregnancy. And also, wobɛtumi anya miscarriages. Nti bia wɔ BP na sɛ wonyinsɛn a, your risk of getting miscarriages will be high, and your risk of getting IUA, bisa akwadaa no bɛwu wɔ wo yam, bɛwo preterm baby, because ebia wo BP ni bɛkɔ soro a, doctor bɛka sɛ oh sɛ BP no ayɛ ne deɛ, agye sɛ yɛyi wo ba no, ɛnso wobɛtumi anya preterm baby through that. So you have to check your your blood pressure as well during this period. So if it happens you have hypertension, because a lot of people is living with hypertension but they are not aware of it. Nti, you can use this opportunity to check your blood pressure before you get pregnant. Then our next condition is epilepsy. Epilepsy, you can't say a try a friend a tray. Those having this condition have have problems with their neurons. Like it's connected to the brains. It's like pertain to the brain. It will be with epilepsy and not a child. Also making sure say or be reported to hospital before getting pregnant, because some of the drugs prevent the absorption of vitamin B9, which is folic acid or folate. And this drug also prevents neural tube defects. Into somebody having such condition should seek it so that they will reduce, even if the person is on medication, they will know how to reduce the doses of drug that will be given to her. Next thing is genetic screening. It's another component of preconception care. Baby, I am part I wanted there as a man in in the developing countries. It seems like it's only pregnant the woman that gets pregnant, but it involves two people. Say, onyima Wopɛ sɛ wonyim anaasɛ woyɛwɔ so wo ne wo partner wohu wo blood group. Ebi a amoxicillin ɛna bi a G6PD. Ne nyinaa ho hia. G6PD and other conditions like even resource factors is another issue of concern. So with the G6PD, we're talking about G6PD. G6PD deficiency. G6PD, as it stands, is an enzyme that prevents red blood cells from breaking down. G6PD, ɛnyɛ yareɛ, but yɛfrɛ bi enzymes. Ɛmmoa ma nipadua no etumi ɛyɛ adwuma yie. Yɛwɔ enzymes bebree ɛwɔ yɛn nipadua mu. Even ntɛso a ɛwɔ yɛn nipa yɛwɔ enzyme wɔ mu a take in starchy foods a ɛboa breaking it down. Saa nso na yɛn mogya no nso so as it stand, we have an enzyme. Nti G6PD yɛ an enzyme a protects red blood cells no. Blood no was cell bebree or white blood cell, red blood cells, any other ones. Nti protecting red blood cells no from breaking down. Okay. Nti more deficient no na ɔmo say wɔ G6PD or G6PD, but G6PD nankasa at a stand is an enzyme that prevents the red blood cells from breaking down. So those who are deficient of G6PD, so we call it, and the G6PD stands for glucose 6-phosphate dehydrogenase. So people who are deficient to this enzyme, it can be either partial or full defect. Partial defect or full defect. So with those with a partial defect, it means they have little of that enzyme, the enzyme G6PD. And those who are full defects, they don't have that enzymes at all. And these enzymes to protect the blood and then blood cells from breaking down. And there are things that triggers hemolysis in people with red blood, people with G6PD. More G6PD full defect no. Red blood cells, it's say BBM protecting internet tie breaking tie tie low HB. If it be HB hemoglobin level. More full defect in partial defect baby na tie low HB because ade na ɛbɛbɔ red blood cells ne ho ban sɛ break it down no. Break it. And red blood cells na carry oxygen. Part B wɔ hɔ ɛfrɛ no hemoglobin it is within the red blood cell. Ɛno na carry oxygen. Nti if obi wɔ hɔ if such person takes some certain substances it can lead to hemolysis. Hemolysis is mogya blood cells na break it. Blood cell biara wɔ ne lifespan. Some are 120 days. After 120 days, na body na kasa a break it down na asan form foforɔ. But ɔmo G6PD deficiency no. Nneɛma bi wɔ hɔ a ɔmo fa kɔ mu nipadua mu a ɛtumi affect wɔn. If that person gets infection, bacterial or viral infections, it can cause hemolysis. Ɛbɛtumi ama red blood cells na break it down. And some painkillers like aspirin, they shouldn't take it. If you have this condition, then you have to avoid over-the-counter drugs. And no na total drugstore no. Anyway, no so ujai. Unim o G6PD status on say was so check now because anyone will be hormone fat. And some antibiotics so and pregnant women who have been going for ANC clinic, they check this type of they do these investigations for them. G6PD. So those who are partial defect and full defect, they don't give them the SP. So sulfadoxine pyrimethamine is an anti-malaria drug that prevents pregnant women from getting malaria. But because they don't have this enzyme in their blood, they are not giving side drugs. So if you are a pregnant woman and you go for anything because they tell you because of this your condition you cannot take this drug, that is why if they give this drug to you, you can react and then it will cause hemolysis. It will cause breakdown of your red blood cells. And there is a particular beans which these people don't take. Yɛkasa deɛ ɛka ne adua patram ɛyɛ beans ɛsoso paa mpanimfoɔ no taa de yɛ nkwan. Yes, that's the picture showing. These beans in particular, those with G6P deficiency don't take it. more that condition, yeah, the way I'm climbing won't mean because it will cause hemolysis. And another thing is the naphthalene. You can't camphor no. If you have this condition and I say we use to camphor or naphthalene or mothballs, it can cause hemolysis until you should note it. Then next is immunization. As for immunization, what we've been taking is the tetanus. So, but in foreign countries, they take flu, they take measles, and then rubella. Rubella is linked to fetal abnormality, and then it can cause abortions. So in the developed countries, they do immunization. They check if you have immunity to these infections. So if you don't have, then they will give you the vaccine to prevent infection. We have STD screening. STD screening are like sexually transmitted diseases. But baby, I want the year no yɛnyim a na yɛkɔ clinic nti woanyim a amfa wohu so wɔ condition wei. Ebi ne HIV is STD, hepatitis B is STD, gonorrhea, any others, syphilis. Nti no, during this period preconception wonyinsɛnyɛ no wobɛtumi aseki akɔyɛ saa labs wei if you only want to get pregnant. Wobɛtumi akɔyɛ labs wei sɛ bia if you are not having such conditions, then you can embark on it. And we have medication review. CB or honoma, if somebody is having hypertension or diabetes or any other condition, any medical condition or any other condition, you can go to the hospital and for drug review or medication review because some of the medications are linked to fetal abnormalities. Nnuro no bi wɔ hɔnom a yɛanyɛ ama pregnancy apemfoɔ. Nti te sɛ bi te sɛ BP drugs yɛwɔ apemfoɔ deɛ wɔ hɔnom ɛna yɛwɔ obi a ɔnyem deɛ wɔ hɔ. Nti no wopɛ sɛ wonyinsɛn a anaasɛ wonyim a dɛm nyɛ so wopɛ sɛ wonyinsɛn a ɛwɔ sɛ wokɔka kyerɛ wo doctor no sɛ doctor ebi a baabi a woadu deɛ wonyaeɛ a wobɛnyinsɛn na wayɛ dɛn wate aduro no so anaasɛ wa-review wo drugs no ama wo na wama wo deɛ yɛde ma apemfoɔ no bi to prevent birth defects. And we have teratogenic and environmental toxicants. If you are preparing to get pregnant, you have to stay away from such things. Teratogenic agents are substances that can cause birth defect or fetal malformation. Nti saa aborɔfo kakraka wei nyinaa teratogenic ɛyɛ adeɛ a ɛbɛtumi akɔse fetal abnormality. Ɛyɛ adeɛ a ɛbɛtumi ama wawo akwadaa a wadi dɛm. Ebi wɔ a bɛwɔ akwadaa ne part baabi nni hɔ, n'aso nni hɔ. Just why exposed to teratogenic. And example of teratogenic, no, it includes some medications. Na make us be a BP no bi wɔ hɔ no ma ebetumi akɔse birth defect. Nti wo person nyɛ ma so kɔ near review ma. And I be a yɛrɛ te sɛ rubella, it may cause birth defect. Yɛrɛ te sɛ toxoplasmosis, ɛno nso saa. Ɛna te sɛ high glucose level or diabetes na you uncontrolled that diabetes I should still change na wo mogya nim na kasa no it may cause birth defect eno de enye na edu na sugar na kasa na wo mogya nim san make am sugar na kasa it can cause birth defect so it will be a teratogenic at that time. And radiation, high level of ionizing radiation ebi a wo ye adwuma wo X-ray department and baby on use radiations ɛde yɛ adwuma ɛno no ɔsɛ wobe person nyinsa so wo no mpanifo kasa na bia ɔmo yi free hɔ na ɛyɛ saa wonyim a as early as 8 weeks wonyim a first 8 weeks that time na baby no sɛ something bi a wanyim 8 weeks na person wo de aduro kana wi a that time no wonyim dada that time na baby ni forming no wo fa other substance akɔ betimi asesa baby no how the baby is forming. And we have environmental toxicants. These are substances that can harm human health and the environment. Examples include lead and mercury. Mercury na yɛde galamsey no. Mercury yɛde galamsey no, it causes birth defect. Nti no, wɔ area ɔmo yɛ saa nneɛma wei na person yɛ so hwɛ wo ho yie because you can get it. You can give birth to an abnormal baby. Pictures maybe na you show earlier on cleft lip, cleft palate. There are a lot gastroschisis and when I real, all these pictures are real. People have been giving birth to such babies. So you have to be careful if you are living in such areas. Our next component is nutrition. A well-balanced diet supports reproductive health, prevent birth defects, supports fetal development, and help reduce pregnancy complications such as HPT and diabetes. Nnuane no a yɛdi no, ɛno nso so it have a role to play when it comes to preconception care. Okay, it have a role to play. Nti also with the well balanced diet, you take carbohydrates, fruits and vegetables, proteins, and then healthy fats. You should prevent saturated fats. Okay, and add more fruits and vegetables to your diet. So some of the essential nutrients for preconception can include folic acid. Okay, we have folic acid and folate. With the folate is found in fruits, and then folic acid is synthesized. It's in a drug form. But green leafy vegetables contain folate. Tisibia, contomere, spinach, and then corn and those things. It contains um, folate. But overheating also it removes it from it eliminates it from your diet. So you taking in overcooked food or overheated food, fancy why you aduane no, wode akɔhyɛ fridge mu ɛnɛ no wayi no ahiti na wate bi no wɔde ankaa no akɔhyɛ mu. Ɛbɛma folate no wɔ mu na reduce koraa, wobɛdi raw food. Ɛna iron rich diet rich in iron nso so ɛyɛ calcium and protein and omega 3 fatty acid. Omega 3 no wobɛtumi anya bi wɔ salmon emu. Okay, so with the folic acid deficiency can lead to what we call neural tube defects. Okay, so if you are preparing to get pregnant or you are preparing for a pregnancy, you have to take folic acid 400 microgram. Or if you've had a baby with a birth defect before, one will baby already then be that folic acid also have 5 milligram. And then when you get over the counter drugs, a preventive birth defect, neural tube defects. Nti no, wopɛ sɛ wonyi sɛ ɛna ɛno koraa nso ɛboa wo baa bia because of monthly menstruations no, as a woman you can take it. Wobɛtumi afa ɛbɛboa ɛno nso it protect the red blood cells from breaking down. Nti no wobɛtumi afa ɛna ɛno nso at the other hand so it prevents birth defects like encephalocele, a whole lot, yes. As it is showing on the screen, it can prevent these things. Or it can reduce because there are certain things you cannot prevent. Yes. The one with no head, that one is called an encephaly. And we have the spina bifida and then encephalocele. So if you take folic acid 5 milligram, then you can prevent such things. And even if you are epileptic client, you should take folic acid so that your risk of getting such babies with babies such as anencephaly, encephalocele, spina bifida, it will be reduced. Your risk of getting it will reduce. So during this period, there are certain food that you have to avoid. Some include fish like shark. Ebi mo shark, but area hand ebi mo be shark. And I say king mackerel, and tuna opoku. It contains high level of mercury. As these fishes lives in the sea, it stores mercury in its eggs. So if you take such fish, you can get mercury in your bloodstream. And mercury too is a teratogenic substance that can lead your baby that can increase your chance of getting a birth defect baby. And processed meat contains preservatives and high saturated fats. Okay, saturated fat is linked with a lot of problems, HPT and then diabetes. So during this period, you have to reduce your intake of such substances. and sugary drinks like soda. Soda, it contains empty calories, doesn't contain any nutrients. So you have to take a food with fiber, okay, such as beans, like normal beans, not the one I showed on the screen. You can take beans, you can take kontomire and other things. Okay, so next on our topic, our next component is BMI, body mass index. Is the calculation of an individual's weight in kilograms divided by their height in meters squared. Nti BMI na kyerɛ sɛ yɛde calculate bɛ sɛ bi a you are healthy or you are heading towards an abnormal weight. As your weight increases, it increases your chance of getting chronic condition, medical condition like hypertension and then diabetes, and those conditions to affect the kidneys as well. Okay, so during this period, you have to do weight management, or if you think you are obese, yeah. So it is calculated like as a those Ghana cards so actually be at 1.65 meters be also. So if you get to know your weight, unya wo weight na say fan say we 60 kg ube divide it by 1.65 no times another 1 point. It will multiply your height na wo Ghana card ne so no by eno aho. And I say ube multiply it by 2. It will be 1.65 times 1.65. Okay, no we divide wo weight ne by eno. Ahe na obenya na ye will be BMI. Nti no, wonya BMI of less than 18.5 a, woyɛ underweight. Woyɛ underweight. Nti ɔmo so yɛ underweight nso, ɔmo reproductive issues and health issues. Ɛna ɔmo yɛ overweight ne obese ne nso so, ɔmo nso so wɔ health issues. Nti no, obiara betumi acalculate. Wode wonim wo weight a, wokɔ pharmacy shops ne bi, ɔmo ebi mu wɔ scale anaasɛ wobɛn clinic bi a na bɛbɛtumi acheck wo weight so that you will calculate your own BMI. Nti normal BMI it ranges from 18.5 to 24.9. It is a calculate BMI na say we within this range na say you have a normal or a healthy weight. But who calculate now we more than 20 more than 24.9, that's we 25 25 to 29.9 we overweight. It's overweight no also weight me weight management because it is linked with some of the chronic conditions like hypertension and then diabetes, and they have slow metabolic rate which increases their chance of getting wo but or status for your kese say oye bibi kakra bia na wabrɛ. Nti no, if you have this weight, this weight, you should try and manage it and get within the normal range, which is 18.5 to 24.9. So if you have a BMI of 30 and above, then it means you are obese. So if you have a BMI of 30 and above, it means you are obese. So you should start calculating your BMI now so that you know where you are heading towards to. Because having a higher BMI value means you are heading towards chronic conditions like diabetes and then hepatitis. And the way now I say you did no, I said acquire one way. We take a lot of high glycemic foods like rice. Rice have high glycemic
At Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here, with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from at Dr. Owusu Institute, we rise and we grow. Building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here, with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. From sustainable tech to coding dreams, we're pushing the limits, we're chasing the beams. Empowering minds from every walk of life. Through education, we cut through the strife. Innovation thrives where hard work's embraced. At the center of progress, our dreams are laced. Training today for the challenges near. At Dr. Owusu, we pioneer. Get there from here, with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. Through every course, every line we ignite. We're shaping the world, we're guiding the light. With Dr. Owusu's vision clear and true, the future's bright and so are you. Get there from here, with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. Dr. Owusu Institute, where dreams take flight. Through education, we ignite the night. Get there from here, we're leading the way. Building tomorrow today. At Dr. Owusu Institute, we rise and we grow. Building skills for the future with all we know. Through education, training, and research we lead. Advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here, with knowledge in hand. At Dr. Owusu, we take a stand. Promoting
Sorry
change
for
with passion and
sorry.
might.
Let's continue. So with the body mass index, as I was saying, if you want to do a weight management, you can contact the nutritionist or the dietitian so that you know what to take and the time you will take. Okay. So in conclusion, preconception care is essential. Healthy lifestyle choices matters. Chronic medical condition requires special considerations. Mental health is crucial, and genetic counseling can provide valuable insight. By working together, we can promote a healthy pregnancies, improve birth outcomes, and support the well-being of families. Thank you for watching.
Thank
See
you
you.
very much. Ms. Kramer, we are very grateful for having you on this show. Please, the audience, do you have any questions? Miss Krama is ready to answer any of your questions. So if you have any questions, kindly address it. Okay, there's one question here.
Okay.
Miss Krama, please, someone wants to know that doesn't mean that if you are, let's say, 40 to 50 years, uh, is it the chances of getting pregnant is very low, right?
Yes. Your chances of getting pregnant at that age is very low, but it depends on the individual because some people have late menarche. Like menarche
Oh,
is your first menstruation. So let's say if you get your menstruation around, let's say 18 years, definitely you will get your menopause late compared to someone who gets her menarche at 11 years until it is happening. 10 years, they are getting their menarche. So definitely they will get into menopause earlier. Okay, so that is an age. So it depends on the individual.
oh, okay, okay. And please, someone also wants to know that is it advisable to do self-medication if you are pregnant?
No, as for pregnancy, it is not advisable because if you get pregnant, you can get in a state of emergency at any time. Even if you don't have any chronic medical condition, you can get into a state of emergency at any time. You can start bleeding at any time. So, if you are pregnant, you should avoid self medication. If you have any problem, you should visit your antenatal or visit your hospital or inform your doctor or midwife for advice.
Oh, okay, okay. Thank you very much. And please, some pregnant women sometimes when they get pregnant, their system or like they don't really take any vegetables, fruits, and all that. Like they love taking sodas, like drinks and all that. Like, is it advisable?
No, it's not advisable. But during antenatal time, they give them supplements. Like they give them folic acid, multivitamins, and those drugs. But it's not advisable to take empty calories like those drinks because what it's going to do is going to elevate your blood glucose and put you and your baby at higher risk. And also, you taking such nutrients will also lead to anemia. Your hemoglobin level will reduce. So, if you have such problems, you visit your midwife or inform your doctor or midwife.
Oh, okay. Okay. Thank you very much.
You're
Okay.
welcome.
As we wrap up today's session, on behalf of my team and I want to extend a heartfelt thanks to you to our incredible guest, Miss Krama Margaret, for sharing such valuable insights on preconception. A big thank you as well goes to all attendees for being part of this conversation. I hope today's session has sparked new ideas and perspectives. Let's continue exploring, learning, and driving positive change in our field. A special thanks to our sponsor, Graphic Professionals, your trusted provider of graphic design, web design, and hosting services. Once again, thank you for joining us. Stay connected, stay inspired, and we look forward to seeing you at our next Innovation Spotlight webinar. Have a wonderful day. Bye bye.
At Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds